thank you all for joining us. I'm gonna, as folks come in, I'm gonna just say welcome and thank you so much for taking time to join us. And Alex, I think I made you the host, but if you could, oh, got it. Thank you. Good, perfect. And thank you so much for joining us. I know for many of you, it's a holiday weekend, so we really appreciate the time that you're spending with us. So we're going to let folks kind of trickle in. And as you do that, I'll just introduce myself. My name is Cindy Chavez, and I am a member of the Santa Clara County Board of Supervisors, and we're very excited to have you join us to learn a little bit more about being a community ambassador. I know many of you know that we're really working hard to get everybody vaccinated, and get good information out, good solid information, and you all as neighborhood leaders have followers, and we want to make sure you have the information you need so you're able to really educate your friends and family about about COVID-19 and how to keep themselves safe, and also encouraging people to make sure when it's their turn that they get vaccinated. So again, I want to thank you all very much for being here, and some of you I know are returning for a second training. It's always good to get more information, and some of you are brand new. I do want to just say how much I appreciate the leadership. Your being here today shows to how you care about the community and making sure that all of our community is safe. And so really what we want are trusted leaders to make sure that they're getting information out to our community. This program is really intended to give you the information you'll need to be credible. And if you see information out in the community that's not credible, you'll both be able to respond to it, but also be able to educate us about what information we may need to get out to the community. So our hope is that you'll leave this training with the confidence and information you need to be a COVID ambassador in our community. So again, we're thankful and asking for your help. And as you know, we're still experiencing COVID cases and hospitalizations in our county, and our vaccine rate continues to rise, but we need your help to continue the good work to build off of what we've been able to accomplish so far as a community. The county's Emergency Operations Center, Dr. Cody, and the public health departments are doing what they can, but despite our best efforts, the county has been unable to reach all of our residents with information both about how to keep themselves and their families safe. And so the goal of this program has been to recruit between 500 and 1,000 ambassadors. I think we're close to 600 ambassadors now. We're doing the program both for English speakers, Spanish speakers, and Vietnamese speakers, and we're doing one for Hindi speakers. So we're reaching as deep into the community as we can. And we're really grateful to leaders like you that are well connected for joining us. So after today's training, we'll be sending out a follow-up email that will include a CAP program interest form that you can either click the link and fill out a Google form or reply by email with your response. We're going to ask you to sign up for the weekly outreach toolkit. And today we're going to ask you to sign up for the Facebook website. I'm sorry, Facebook link for the community that's been helping us. And we'll make sure that after you fill out the form that you are part of our database of ambassadors. And on an ongoing basis, you'll get toolkits every week with updated information and fun videos as we find them, along with the message of the week. And you'll get these infographics in multiple languages. So that's the ambassador program overall. And I just wanted to see if there's anybody that is interested in asking any questions about the program itself. And if you're interested, you can either go to the Q&A box or you can raise your hand and I'll respond to questions. All right, I don't see any there. So with that, I'm going to really introduce our main presenter, and I'm really grateful to Dr. Smith for being with us today. He is our Santa Clara County's Chief Executive Officer, also happens to be a medical doctor and a lawyer. And so he's going to kick us off with a kind of a basic 101 program about COVID. And then between each topic, we'll have a brief Q&A. And the other topics that we're going to cover besides the COVID-19 101 is we're also going to do a testing 101 and a vaccine 101 so that we're able to give you all the information that you need. And then we'll do a little bit on the community outreach program and make sure there's time for questions in between all of those. All right. So Dr. Smith, I'm going to turn it over to you.
Okay, thank you, Supervisor. I'll share my screen here. Hopefully you can see that.
Yes, we can. And if you can make it full screen, might be easier for folks.
Is that better?
Yeah, perfect. Thank you.
Okay. Well, thanks again. And to everyone listening, this is really an introduction to COVID. Much of what I say you probably have already heard to some extent, but to make sure that we're all on the same page of the playbook, just wanted to go through a little bit historical and in basic foundational information. So COVID-19 is caused by a new virus, never seen before in the world and before 1119. It started, or at least the first case was identified and publicized in China in 11/17, 2019. Whether it was there before or not, we don't know. But it's a virus that's called SARS-CoV-2, a coronavirus. And coronaviruses typically in the world have caused a number of human diseases in the past. Most commonly is the common cold, which is a different form of the coronavirus, obviously not as serious as COVID, but also some of you have probably heard of MERS and SARS, which were other diseases caused by coronavirus. Much smaller epidemics, didn't typically affect the United States too much and were pretty well contained. However, COVID has been an extremely serious pandemic. The first death happened in our county in early February of 2020. And so far, it's killed almost 3 million people worldwide, and there have been about 130 million cases worldwide. And I think it's important to look at the history of pandemics in the world and get some idea of how COVID fits in. The most commonly talked about pandemic in modern world is the 1918 Spanish flu, which was a flu virus, very much similar to the viruses that we typically get immunizations from on a yearly basis. But because there was no immunity and because there was really no specific treatment and obviously no vaccines during that time, the Spanish flu spread rapidly and caused many deaths, approximately 50 million deaths, or 2.68% of the world population. Obviously a huge problem that caused much death and destruction worldwide. By the way, it's called the Spanish flu not because it started in Spain, but because most countries at the end of World War I were not sharing information. Spain was the only country that was sharing information about the disease. So therefore it was called the Spanish flu. But a huge problem, and we'll talk some more about that in a bit. Then other respiratory viruses that have caused pandemics. In 57, there was the Asian flu, which killed approximately 1.5 million people in the world. The Hong Kong flu was killed about 1 million people, lasted a lot longer than both the Spanish flu and the Asian flu, because in 1968 there were some treatments and there was not very much reliance upon social distancing, So the pandemic lasted longer and longer because you'll see later on viruses mutate in order to survive. And the longer that you have it circulating in the community, the more likely you'll see mutations. Then there was another pandemic in 2009, which was called influenza A, which again was the same type of virus as the Spanish flu. Not quite as deadly because we're in the modern era and because prevention and treatment was available and people were immunized, and only caused about 300,000 deaths. But SARS is a totally different virus than these four viruses. It's not like the flu. It's, as I mentioned, similar to the common cold, but causes illness in a much different way than the flu does. Here's a picture of the COVID virus. In 14 months in the United States alone, it's killed 554,000 people. The entire World War II in 4 years killed 291,000 combatants. So you can see it's a enormous problem and very deadly, and people who say that it's nothing have not looked at the statistics. Now, to give you some idea of how the human population responds to pandemics, this is going back to the Spanish flu, and this is a graph of the deaths. I haven't put numbers in just because it's not relevant right now, but you can see that over the period of about 2.5 years, there were spikes, or what we now are calling waves, in the number of deaths suffered. This is worldwide data. And again, remember, the Spanish flu happened when there was no immunity in the population, so things like herd immunity weren't talked about. There was no standardized approach to social distancing. There was no treatment modality. There were not ICUs. So this is really the effect of a pandemic on a very unprotected population. And you can see there's 3 spikes. The first spike, which looks a little smaller, represents the deaths that occurred in populations who were most susceptible. So typically in the flu, it's the elders and young, people with immune compromise, or otherwise having health problems. As those individuals, that population begins to pass away, the virus decreases in prevalence because it's killed its host. So then it takes a while for it to continue to spread back to a critical mass when it starts causing more deaths and destruction. And then the second wave is a much higher wave, because this is the wave where the virus is infecting so-called normal people, people who have normal resistance, normal health care, not elders, not kids, not susceptible populations, but the average population. And what's happened at that point is that the virus has become so prevalent that people get large doses of contagion when they're in the population, and lots of people get infected. Again, it begins to kill off those people that have been infected, and it drops down again, and then builds up again. And then the third spike really represents a resurgence that's based on new virus, new variants, new challenges with the virus changing its susceptibility. And so this is typically what you expect. And then in lots of pandemics, there'll be 4, 5, 6 waves. It depends on how susceptible the population is to the virus, and how many variants there are, and how effective the virus is in spreading. So now to look at our county, this is data from yesterday, actually 2 days ago, sorry. This is the death data in our county, and you can see we had an initial spike, March, April area of 2020, and then a drop down a little bit, and then another little spike in September of 2020, and then a drop down a little bit, and then another huge spike in January, February of 2021. And right now, if you look at the far right, you see this gray column. That column represents data that still hasn't been reported through the state system. We get this data from the state CARES reporting program, which takes some time. There's a time delay. So the columns that are in the gray are incomplete, so you can sort of ignore them for the moment. But you see at this very end, there's this leveling out that we're very concerned about, where it looks like we're coming into a level number of deaths, which is a very bad sign, meaning that we might be right at the beginning of another spike. Now you look at the number of cases. This is just cases that are identified. You see a similar structure, but typically you see the case increases about 2 to 3 weeks before the deaths, because once somebody's contracted the disease, it takes some time to have the most serious side effects. But again, before January and this big spike in cases, we got up to one day where we had 2,253 cases identified in one day. And now it's dropping back down. But again, you notice it's beginning to level off, more like what happened back in September, October. Again, a very significant concern that we might be leveling off to a preparing for another spike. And this is our data about vaccinations. And let me just talk about vaccinations a little bit. There's lots of talk about the different types of vaccines and the different vaccines that are available right now. There are essentially in the United States 3 approved vaccines. One is Pfizer, one is Moderna, one is J&J. Both Pfizer and Moderna are essentially very similar types of vaccines. They're unique types of vaccines. The first ever used in humans. They use what's called mRNA technology, which means that what's injected into your body is messenger RNA, and then your body takes that messenger RNA and develops proteins from it that are equivalent to the virus protein. So there's no virus in the vaccine. What happens is your body makes the protein that is equivalent to the virus protein, and then your body reacts to that viral protein, the so-called antigen, and you develop an immune system that's reactive to the protein that is covered or carried by the virus. Therefore, when you get exposed to the virus, your body has immunity and fights it off. The J&J vaccine, however, is a different type of vaccine. It's more typical, very much like what we are aware of with the flu vaccine and other vaccines. How they make the J&J is that they take a blank virus, a virus that's been denatured, and they attach proteins from COVID virus, coronavirus, to that blank virus, and you're injected with that. You still have no live virus injected in your body, but the proteins come directly from the virus, not from your own body. Both both Moderna and Pfizer require 2 doses, one booster, one primary dose. And at this point, J&J only requires 1 dose to get immunity. All 3 vaccines are very, very safe, very, very minimal side effects. All 3 have great efficiency and effectiveness. Turns out the 2 mRNA vaccines are stupendously effective. And J&J is much more effective than a typical flu vaccine or any of the other vaccines that you get. So they're really safe, very effective vaccines. So these are the statistics of what's going on in our county right now. Again, from Friday, you can see that these numbers represent all residents 16 years and older, and about 613,000 people in our county who are in that age group have received at least 1 dose, and 360,000 have completed their vaccination schedule. So for the Moderna and Pfizer, that means they've gotten 2 doses. For the J&J, it means they've gotten 1 dose. So 22% of the population has completed their vaccinations. And then below that, we have the breakouts from age, gender, and nationality and race. Again, remember, these numbers come from the CARE database, which is a state database, and it's delayed a little bit. So they're not totally up to date. And we typically find new evidence of vaccinations 2 to 3 weeks later, but they give you a general feel of what's going on. And I particularly want to point out the columns on the far right, which are the race and ethnicity data. You can see that African American and Latinx populations are lower percentage-wise than other populations. These are the blue part of the column is the number of people vaccinated. If I had this live on the web, which you can find on our website, it would be able to tell you the exact numbers of people vaccinated. But the gray part of the column is the total population. So I can tell you from having done this earlier, Latinx is in the 20% range. White and Asian are in the 35 to 40% range, and African American is also in the 20% range. So we've been trying very hard to target our vaccine into high-risk populations, the Latinx population, the African American population. We can talk a little bit about that later, but it has to do with special attention and special appointments for those populations. This gives you some idea of the progress of the disease in our county. This is the blueprint from the state. These are older data because it's not really all that significant anymore. You remember hearing a lot about purple tier, red tier, orange tier, yellow tier. As of the 15th of April, announced by the state yesterday, the tiers still exist, but essentially they've changed the goalposts so that everybody will be moved into the lower tiers. But you can see that we were spiking up high in terms of our positivity rate in January, as we already talked about, and we're now coming down low. But again, another spike on its way. A little bit about symptoms. COVID can be very symptomatic or can be totally asymptomatic, meaning no symptoms. Typical symptoms are fever and chills and cough, but pretty much any kind of symptom that you might expect with the cold or the flu is possible. However, in about 20% of those individuals, they will get really severe disease, much different than a cold or the flu. Severe attack on different parts of the body, the lungs, the heart, the blood system, the liver, and the rate of death is somewhere in the 1 to 2% range. So you can think of it sort of as a common cold on super steroids. You might get it and have no symptoms, but you might also die. So not something to play around with. And here's a little bit about the red tier. You can also find these data on our website, sccgov.org. Tells you what tier we're in, what that means. We're now in orange tier, and this is a representation of red tier. So still, the main things to remember are that masking and social distancing are really the only proven ways to prevent COVID. Even when you're vaccinated, you're safe, but the people around you aren't necessarily safe. So masking and social distancing is important. And that has to do with the fact that the way that COVID spread is just like the common cold or the flu is spread by droplets in the air. And these little red dots are supposed to be droplets, but they're very small little droplets. You can't see them. When you sneeze, talk, scream, sing, basically anytime you open your mouth, droplets come out of your mouth and have the risk of exposing others. So being far away, having a mask, having open air, being outside is much less riskier than being inside and being without a mask. So with that, I will stop and turn it back over to you, Supervisor.
Thank you so much. And I'm also really excited that Dr. Sarah Redmond is with us and who can also respond to questions. And Dr. Smith, you covered a lot there. And the one, so what I'd like to do is let me just open it up for questions. And I'm going to read one that's in the chat right now, which is a friend lives in a zip code up by Grant Ranch and is not accepted by the vaccine sites as being part of Santa Clara County, which she believes she is. May she use my zip code to schedule an appointment, or will this get fixed? Dr. Smith, do you know the answer to that, or Dr. Redmond?
Well, I'm not really familiar with exactly where you're talking about, but I would say that if she thinks she lives in Santa Clara County, to go ahead and make an appointment through SCC SCCfreevax.org.
And if she's having a problem, and I'm going to ask Kathy just to put her email in the chat for you, and we'll follow up with you to make sure she can get an appointment. Because I understand that she may be being redirected somewhere else because of her zip code. So we'll work on that. Yeah, we'll help. Okay. Are there any other questions about the vaccine? And I know, Dr. Redmond, you responded to one question about how quickly the vaccine, I'm not sure the right word, but how quickly the vaccine takes hold. But maybe you could respond to that verbally, both in terms of the single shot with Johnson & Johnson and what happens if you get both shots.
Sure, happy to. And thank you so much for the chance to be here with this important
Good to
group.
see you.
Nice to see you too, Supervisor. So there's probably some benefit within a day or 2 or 3 after even the first shot of a 2-shot series, but not enough to be what we think of as fully protected as much as the vaccine provides that protection. We think of somebody as having reached as much protection as they're probably going to get from the vaccine about 2 weeks after whatever the last shot is. So if it's a 2-shot series, like with the Pfizer or Moderna vaccine, it's 2 weeks after the second shot. If it's a 1-shot series like Johnson & Johnson, it's 2 weeks after that 1 shot.
Thank you. And then another question is, it said, I notice you aren't mentioning long haul COVID. For those in my age range, I understand we are unlikely to die of COVID, but 30% will get that. How can you address long haul?
I think that's a tricky question. There's still a lot we don't know about long haulers. Who is at risk for having what we think of, or we're starting to use the term long haul COVID to describe people who have prolonged symptoms or some sort of long-term effects, whether that's weeks or months. And because this has only been around for a little over a year, we just don't know what that course looks like. We also don't know a lot about who's likely to get it or what that long-term effect could look like. So that's one more reason we just want everybody to stay safe, to continue all of the protective measures like masking and distancing where you can, and everyone to get vaccinated. We know that, again, that risk of long-term infection is probably fairly rare, but absolutely can happen. And I think because there's so much infection out there at this point, we all know somebody who is suffering with long-term effects of COVID, and we want to do everything we can to prevent that.
Thank you so much. Are there any other questions that folks have about the vaccine or anything else related to the vaccine? Since we have Dr. Redmond and Dr. Smith here, and you can either put it in the chat, you can put it in the Q&A, or you can raise your hand. So I'm gonna, Sandy, go ahead. I think Victor, if you can help people unmute themselves. And we have Lance. I don't know where she went.
Oh, yeah, Sandy, I think put her hand down. But Lance, I'm going to send you an invitation for you to unmute. If you could please accept the invitation. There you go.
Okay, can you hear me okay?
Yes.
Yes, perfectly.
Yeah, I have a kind of a specialized question. What are the resources available for housebound elders? Like, I'm taking care of my mom who's in advanced dementia and is really not able to go out and sit in lines for multiple hours without a major issue. So is there any resource or place we can get an appointment for a home visit for the vaccine? I know that's difficult, but I'm kind of in a situation I don't know where to go.
Yes, Dr. Redmond has an answer for you.
Absolutely. Thank you for that question. We do have a specific program for in-home vaccination for folks who meet the Medicare or Medi-Cal definition of homebound for medical reasons, unable to leave their home except in certain circumstances. So we do have a program for your mother. I'm so glad you asked. The same way to access that, as Dr. Smith was describing, is by going to sccfreevax.org and looking for the in-home option. There's sort of a patient request form that you can submit. You'll get a call back from a member of our team to talk through to make sure they meet the criteria. And then we'll get you scheduled as fast as we can. You can imagine there are a lot of folks who meet this criteria and we want to get to them as soon as we can. So I know we're moving as quickly as we can, but yes, there is a resource, and yes, it's available for you to go ahead and sign up now.
Thanks for that question, Lance. And I just want to remind folks that what you'll see in the chat is the sccfreevax.org. And there's a question that says, none of the people I know who are 50 to 65 can get an appointment in Santa Clara County using MyTurn or CVS. Do you have any suggestions? And I don't know if this is, yeah, Dr. Redmond, if you can respond to that issue.
I'm curious if Dr. Smith would add something. I think we are in a tough circumstance where, on the one hand, the county is doing a really wonderful job of getting every vaccine that comes to us out into a person as fast as possible. But we aren't getting as much vaccine as we wish we were, and as we know we need to get to everyone as quickly as we can. So the same location that's being shared here is the same place to go and find all the possible options for vaccine appointment. And we will be increasing those as quickly as we can the moment the state offers us additional vaccine supply. Dr. Smith, would you add anything to that?
Dr. Smith, if you're speaking, you're on mute.
Sorry, you'd think I'd figure this out by now.
All of us.
This is SCC Free Vax. You can see their little buttons here. You can book an appointment. You can find out about vaccine safety. You can updates. You can also go to the data that shows how much vaccine has been delivered in the county. But if you go to book an appointment, it gives you all of the locations that we're involved with in the county that provide vaccine. And then when you click on those buttons, you'll be able to make an appointment. You know, CVS, Walgreens, if you're a veteran, Palo Alto VA, if you want to go through the county system there, Stanford there, Costco there, Kaiser, PAMP, Stanford Children's, Eastridge Mall, which is focused over on the east side, run in conjunction with Stanford and others. And then, as Dr. Rudman pointed out, there is also a link as you go through to get vaccinated if you're homebound, I should say, to be put on the list. This particular process has been very frustrating because we get our allocation from the state once a week, and we don't find out about it until typically Tuesday night or Wednesday morning. We find out how much we're going to be allocated the next week, the next Monday. And so it's been really hard to book appointments very far out. But this particular week, we did get more vaccine than we did last week. So there will be more first dose appointment availability this week than there was. So it's still small in numbers. It's about 35,000 appointments, which sound like a lot, but go really rapidly because every day we're doing about 10,000 vaccinations. We're only operating at about a third of our physical capacity, and that's why we've been pushing very hard on the state and the feds to get more vaccine, because we could do over 200,000 vaccinations a week if we had the vaccine available to us, and only getting 35 to 40,000 is just not adequate. That's about all I have to say about that.
Thank you. Dr. Rudman, did you want to add anything to that, or?
No, nothing further.
Great, thank you. I'm going back to the Q&A, and I'm sorry, the chat, and one of them says, I'm a VMC pediatrician. Thank you very much for being here, doctor, at Tully, and I've been assisting at various vaccine sites using the public-facing website the few weeks. It's been very difficult to get appointments, and you're totally right, and this is all about supply, which is why we're working so hard to try to get more into our community. May I ask that Sandy get a chance to ask her question, and then we'll go to the Q&A boxes.
Of course, Sandy, I will be sending you an invitation to speak. You could please accept it.
Thank you for taking my question. Like the previous person, I was having trouble trying to set up an appointment on the website on SCC Free Vax, and my medical provider is Palo Alto Medical Foundation, and when I clicked on that, it just kept on taking me to the same page. It would never allow me to to register or set up an appointment. And then when I got to the calendar, I had to click each day. Why couldn't the website tell me what's the first available? I found it a little frustrating.
Yeah, that sounds frustrating. Dr. Smith, do you want to respond to that? I think I know the answer, but I don't want to, I want to make sure I'm accurate.
The way I understand the question, the links that we have at sccfreevax.org go to the particular IT system for that provider. So what our link does is just goes straight to PAMP's system, and PAMP is set up differently than Kaiser, set up differently than others, and we've received information from PAMP that they really didn't get any significant new vaccine this week. So I'm not surprised that their appointments are filled up. That being said, we still have the no wrong door policy, so you can try to sign up through the county system or through any of those other systems, Kaiser, any of the community clinics, where there'll be more available first doses, but still not adequate to meet all of the need. By opening up to essentially everyone who's over 16 in the county as of the 15th, the state has increased the number of eligible individuals in our county up to well over 1.5 million. And as I mentioned before, we, the county system, are only getting about 70,000 doses a week. And the entire county, that includes individuals that are systems that are getting doses in different ways, is only a little over 180,000. So there's going to be a shortage for some weeks, and that will make it really hard to get appointments. But if you just keep persisting, eventually you'll get on.
And I would say, just to kind of be even more direct, which is this, that we have a concern about supply and then telling people that they're going to be available. That said, we have the capacity to vaccinate 30,000 people a day, just the county itself, not with our partners. And as that vaccine becomes available, we're going to continue to ramp up so we can hit those numbers. As an example, I think that 49er Stadium right now could go to 15,000. We're not doing close to 15,000 a day, but we could. And the question that's in the chat about whether or not some locations have more than others, the truth is that we're getting as much vaccine out to as many sites as we can. And it really doesn't have to do with vaccine availability between sites. It has much more to do with the total number of vaccines that we're getting in the county. The other thing I'll add is that in partnership with our members of Congress, particularly Congresswoman Zoe Lofgren and Congressmember Ro Khanna, they've been advocating for us to get even more vaccine from the federal government into our community clinics. So you'll start to see that in the next few weeks as well. I'm really excited about that because I think we recognize in our county that, and it's great that we have a lot of people who want to be vaccinated. We want to get you vaccinated as quickly as possible. I don't see any more hands up, so I'm going to go to the questions in the Q&A box. And one is, can posters be available for schools and that you see in the toolkit? And is there a way for you to pick them up for your school district? Yes, we will work with you on that. And I'll again, just Kathy, if you can put your email in, we'll work that out, because we've got some great posters. Some of them are pretty funny. They're actually kind of joyful. So yes, we'd like to get them out to the community. And another question is, if you've got your first dose and then you got COVID, got treated with an antibody, how soon can you get the second dose?
Sure, that's a complicated but really smart question. So what that's referring to is that there are very few circumstances when we tell people not to get the vaccine right away. In fact, even people who've just had COVID, it's safe and probably incredibly effective to get the vaccine the day you're out of isolation. In fact, even if you got it while you're supposed to be in isolation, that's safe and effective. It's just that we don't want to risk you leaving home during isolation and exposing folks. So people can get vaccinated as soon as they're eligible, unless you have a specific doctor say, for some unique reason, I recommend you delay. The vast majority of people, there's no concern that would cause us to recommend delay. The one circumstance where we say maybe you should wait up to 3 months before getting vaccinated is when people get treated for their COVID infection with a specific type of antibody treatment. These are the Regeneron or bamlanivimab. They all end in mab. And they're all infusions. They're all have to be given at an emergency room or in the hospital or in a doctor's office where they set you up with an IV. So if you didn't get a treatment that involved getting an IV, you didn't get this monoclonal antibody treatment. So if you did get monoclonal antibody treatment, that's the time when we say, please wait 3 months before getting a vaccine, not because it's not safe, but because it might be slightly less effective. And really because we don't know if it's less effective. So everybody should get vaccinated as soon as they're eligible, unless a specific doctor, your doctor says there's something unique about you. Even if you've had COVID, the only time we say delay is if you've gotten this specific monoclonal antibody treatment. But in this very unique circumstance that our brilliant questioner is asking, this is one where I would say the CDC and the FDA haven't really come down clearly yet. The most, so as you were saying, it's not unsafe to get the vaccine, get your second dose right away, but it might be slightly less effective. And we just don't know if the benefits of delaying until 3 months after your monoclonal antibody treatment are greater than the benefits of getting your second dose pretty soon after your first dose. The most recent recommendation I have seen is go ahead and get that second dose as soon as you can make an appointment, as soon as you're 3 or 4 weeks after that first dose. Don't delay. But if you have a specific doctor taking care of you who says otherwise, I would absolutely defer to that doctor. So unique circumstance within a unique circumstance. You got your first shot, got COVID, got this special treatment, trying to figure out about second dose. For the vast majority of people, no reason to delay, even if you've had COVID. And it's just in that unusual monoclonal antibody treatment that we say, go ahead and wait 3 months, not because it's unsafe, but because you might get more bang for your buck if you wait 3 months.
Thank you. That's complicated and helpful, but thank you for that. And then one other question, and Dr. Rudman or Dr. Smith, whoever has the most information about this, can you talk about the long-term effects of the vaccine? There's a lot of talk about impacting menstrual cycles, arthritis, going on in the community. And if you could address that as much as we know today.
Sure. So what I would say to that, again, with the caveat that anything relatively new, there could always be more that we learn about it. And so there is a very robust safety monitoring system going on right now. So we didn't just study the vaccine for the 6 months to a year while it was in development and then stop and say, okay, we're done. Basically every doctor or nurse offering this vaccine is also helping to report any adverse safety outcomes so that if something new came to light, we would study it carefully and share it right away. That said, I have not seen scientific evidence of long-term effects of these vaccines. With any vaccine, there is always a very small risk of a very, very rare outcome, a 1 in a million or less common outcome that could have long-term effects. I haven't seen those reported with these vaccines, but I think it's possible. I have specifically not heard concerns about changes or effects on menstrual cycles, and I have not specifically heard concerns or good evidence to show concern for long-term arthritis. I think those are two specifically tricky things to measure also, because if you study any scientific intervention, but vaccines included, it's sometimes hard to tell if the things that happen to a population over time anyway are related to your intervention or not. So a good example is you'll find, you think about those commercials on TV for whatever drug, they say could cause headaches and runny nose and sore muscles. And then you think about how often you have headaches and runny nose and sore muscles and think, well, if I were in any study, I probably would get a headache or a runny nose or sore muscles at some point during that study. So it's hard, and we use statistical methods to understand and try to evaluate, did this intervention really make people more likely to have headaches or runny nose or sore muscles? Or in this case, did the vaccine itself make people more likely to have arthritis or muscle pain or menstrual changes? Or do we just see, if we study enough people over enough time, that some of them have arthritis and menstrual changes? And so to our best knowledge right now, with thousands and thousands and thousands of people studied for months and months, we have not seen evidence that this vaccine increases the risk for menstrual changes, arthritis, or any other long-term effects. But we continue to study it really carefully so that the second a signal like that emerges, we can learn more about it and think if that changes our recommendations around the vaccines.
Great, thank you. That's really helpful. Yvonne is asking about, given the status of that she's been doing outreach on the east side, given the status shown of the Latinx population regarding how many people have received at least one dose, it seems low. What have you been seeing? And is it a matter of supply, need, or is there still a level of trust that's the issue? And then, Dr. Redmond, why don't you start? I'll talk about our outreach program, but why don't you just talk a little bit about what we're learning relative to hesitancy?
Yeah, I think a number of smart questions embedded in there. And I think you're hitting on all of the major barriers to getting people vaccinated. I think the big one right now is supply. Exactly as Supervisor Chavez and Dr. Smith were saying, we have fortunately set up the resources in the county to provide much more vaccine than we're actually getting. So that's number one. Number two is barriers to access. And I think the county is doing a really targeted job and helping our partners to do the same of making sure that the places the vaccines are available, the appointments that do become available, that the assistance that we provide to get people an appointment or get people to a vaccine location are all trying to match exactly who we know has been hardest hit by the pandemic, Latinx community members included. But with all of that, I think we still see greater barriers in certain communities of color in accessing all of those appointments, the time off to get to a vaccine, the transportation to get to a vaccine site, all of that. And so the county continues to grow resources to address all of those needs as we learn more about them. To the last question about hesitancy, yes, we continue to study what we understand or what we can learn about why people who do have access choose not to get vaccinated. And that's a small proportion of people. The vast majority of people out there have, heard and reviewed that these vaccines are safe, are effective, and the benefits so far outweigh any small risk that they're trying to get one when they can. So that's most of what we're encountering. But for those people who are cautious about getting the vaccine, and that's causing them to delay doing so, we don't find necessarily a disproportionate percentage of Latinx community members feeling that way right now, but that's something we continue to study and try to address however we can. And so I think this group is exactly the type of folks we want to hear your input, your knowledge of the community and the folks you're talking to teach us what you're hearing when people say, I'm just not sure I want to get vaccinated right now, to help us understand if there's more information they need, or what would change that perception, what's a meaningful piece of information or a reliable source to hear it from, to help people understand that we in the medical community feel very, very confident both in the effectiveness and the safety of these vaccines.
Thank you. And let me just add one other thing. I think what we're learning from our conversations with folks is it is a relatively small group of people that are hesitant. And I think for many of them, they want to see what happens as other people get the shots. And then there are other issues. And one of them is actually in our chat where we have somebody who's homebound who would really like access to the vaccine and is having a hard time with our appointment system. So for Marie C., instead of reading your comments, what I'm going to do is I'm going to ask Paul Murphy, who I think is on the phone, or Kathy, to put their email in the chat, and we'll work with you on this. Because I will also say that these systems are relatively new, and so we're working really hard to make them work. And when they're not working for the folks they're supposed to be working for, we want to talk to you because we want to make them work. The other thing I'll just reiterate is that we're not using My Turn here because it's not functional for us, which is why we're using our website. I also appreciate that someone let us know that it's not easy to find the homebound information on our website, and we'll take a look at that as well. So thanks for that feedback. And then someone asked if they got their first shot in another state, I'm sorry, I think I got that right. If they got let me give you this other question first. If they got their Pfizer shot 3 months ago, should I get another one soon? I'm a first responder.
Excellent question. I'm glad you asked. So we originally, where I think that a question comes from is that all of the recommendations CDC put out and we agreed with was that the types of benefits you can experience once you're vaccinated in terms of not needing to quarantine if you're exposed or not needing to get tested quite as frequently. The CDC limited all of that to 3 months, and they have since dropped that limitation, as has CDPH and as will we. And so the reason for that extremely, extremely cautious recommendation was just that a lot of the initial studies were so, were relatively time limited. They were on the course of a year or so, but it was felt at that point that there weren't enough data to say how long the immunity lasts. And I think that's still a bit of an open question, how long the immunity lasts, but we continue to see month after month, more and more evidence that the immunity just lasts and lasts and lasts. And so no, there is no current recommendation to get revaccinated, no need to get a different vaccine than the one you got the first time, no need to even anticipate getting one a year from now. That while we are monitoring month after month the ongoing effectiveness of the vaccine, as well as, I know there's another upcoming question about the variants of the virus and how they are also protected by the vaccine. Right now, we are finding really, really exciting long-term data that the vaccine continues to protect months and months in the future. And while we don't yet have the proof of it, because we haven't studied it for 2 years, 3 years, 4 years, it hasn't been around for that long, the type of immunity, the type of cells in your body that respond to the vaccine, it's not just the antibodies, but they're actually cells that can survive for years that help to protect you. The way that we're seeing that type of measurable immunity evolve after these vaccines suggests that probably it's not even on the order of months, but probably on the order of years that you're protected. So really, really reassuring evidence that right now there's no recommendation to get revaccinated once you've had a full course, 2 shots of Moderna or Pfizer or 1 shot of J&J. While we're monitoring that closely, I'm pretty optimistic that we're not going to need to recommend revaccination for people anytime soon.
That's exciting. Wow.
Yeah.
Can someone, did I already ask this question about, can someone get a second dose at the county if they got a first dose out of state? Because they can't go back where they got their first dose?
Yes, in short, yes. And we have systems to help people. If for some reason you were eligible out of state and not yet eligible here, even in those circumstances, we have the ability to help you get your second shot on time. Again, doing our best with limited access to vaccines, but we are prioritizing second shots so that people stay on time. So we have a couple of systems that will help us look up proof of your first vaccination. But if you have any documentation of your first shot, that's really helpful. And if you have absolutely no documentation of your first shot, you can still give us a call to help get set up with that second shot vaccination. And we can look through those systems to try to verify what shot you got and when the first time around so that we can get you the right medication the second one.
Excellent. And we just put in the chat an update on the COVID location to get for home-based vaccine, and that's COVID Vax, VAX, home at phd.sccgov.org, or you can call 408-970-2818. And part of the reason I'm reading that is that we're using this for recording, so we also want to make it available to folks who are listening to this. And so this is an interesting one. Once more vaccines are available, hopefully in the next 6 months, actually we're hoping it's in the next 6 weeks, but I hear you, or more range. If you've received an mRNA vaccine, could you get a J&J also?
So great question. Again, similar to what we were just talking about now, we are finding better and better evidence, both from the sort of laboratory study of the immune response and from who's getting sick, or more importantly, not getting sick months and months and months after their vaccine, that we don't think there's any recommendation for people to get revaccinated months later even whether it's with the same vaccine or a different one. So we think there's no need, no probable added benefit to you to get another shot once you've had the full course of the mRNA vaccines, which are Moderna and Pfizer. Or likewise, if you got Johnson & Johnson the first time, there's no need to go back and get a Moderna or Pfizer vaccine in the future. Both or all three of those options give you really strong and probably really long-lasting protection.
So one of the questions here is, will there be more pop-up vaccination sites? And and sadly, a lot of members of the community don't have access to the internet or don't know how to read and write. And so therefore they won't have access to the vaccines. Having more pop-up sites through the county will really close the gap. And the short answer is yes, we're working on that as we speak. And one of the ways that we're getting people to those sites is that we're actually leafleting and going door to door in the neighborhoods around those sites to alert people that there is a site, and then help them get signed up for that site, and or to be able to drop in and pop in on those sites. We have probably about 100 people that are going door to door and also going to small businesses to help people know when it's their turn to get vaccinated, and turning them on to these particular sites as they come up week to week. One of the reasons we don't post those sites is because we're really targeting those specific neighborhoods, and we want to make sure we can dig deep into those communities and get people vaccinated. Are there any tips? Yeah, we're going to get to those tips, Sarah. You asked the right question. Let me get to this other medical question for Dr. Redmond and Dr. Smith. For people who've received vaccines at a pharmacy at the end of the day that would have been thrown away, especially if they don't have an appointment, there does not seem to be a way to formally secure the second dose either through CVS or the county. And will that change, and how can we help with that now?
Sure. So I'll see if Dr. Smith or either of you can speak to whether CVS or Walgreens has a solution for that problem. I'm not aware of one, but I can help look into it. As for the county, yes, we are able to help accommodate second appointments for people no matter where you got your first shot. So whether it's out of state and you can't go back there, or whether it's at a facility you can't return to for some other reason, because you're right that the county website makes it a little bit more complex, the Valley Connections phone number is the best place to schedule a second appointment if you didn't have your first in a place that you can return to. So I apologize, I don't have that right in front of me. I'll work with Kathy and Alex to see if we can get that into the chat while we're talking now.
Excellent. And we'll also remind all of you that if you've signed up, we have your email. We'll send it all out to you as well. And then here's another question. I volunteer at places in Santa Clara County, and at times we've heard that there were 500 appointments and yet only 400 showed up. Is there any tracking being done to see why canceled appointments, or if they've already received the shot? And I'm going to let Dr. Redmond answer that. And Dr. Smith, I know that this is something that you've been working on as well. Dr. Redmond?
I would say yes, we are working to study that to understand why we have folks who don't show. We're finding it's for a variety of reasons, exactly as folks are alluding to. Some have been able to access elsewhere sooner, and some have not anticipated being eligible and realize that they're not going to be when they arrive. So we're doing several things to address that, including making it easier to cancel or change an appointment. And even for folks who don't have internet access and who called the first time, we have some systems set up to check in with them and make sure they were able to go to their appointment and reschedule if they need to. So I know we're sort of trying to resolve that problem and have seen it improve in the last couple of weeks, but I'll see if Dr. Smith has anything you would add to that about how we're addressing that problem.
No, I think you pretty much covered it. It's a concern that started out with a higher no-show rate in the 20% range, which actually isn't too dissimilar to what happens with regular medical appointments, but it dropped down into the 10% range and seems to be doing better now. But Dr. Rudman's completely correct. We're looking into it, trying to figure out how we can minimize it and find out why people are doing that. And one thing I would add is that nobody should get the impression that if people don't show up, that the dose is wasted. The dose is not wasted. We don't thaw out dosages until we're sure that they're going to be used. And if we do have 1 or 2 or 3 or 10 doses that have been thawed and nobody shows for them, we take those doses to other sites and use them at other sites or at the hospital. So we have an extremely low, quote, real wastage percentage. And actually most of that happens because the syringe or the needle or some other defect in the equipment prevents it from being used.
I also just want to acknowledge that we found the Valley Connection phone number. It's 1-888-334-1000, 1-888-334-1000. And this is a number to use if you have a complication, and we want to make sure that we can dig into that complication and help you get a vaccine. And then I want to go to Dawn's question. This is actually a very interesting one, both for Sarah and Jeff. Many people get concerned about the J&J's lower efficacy, 66 versus Pfizer and Moderna's 94 to 95 efficacy. But to my knowledge, the trials ran differently, so it's not so easy to compare. And that the main matters is a reduction in mortality and serious hospitalization, and all three are 100% in that regard. How do you recommend reassuring people with J&J? And Dr. Rudman, can you maybe speak a little bit to the efficacy issue?
What a good question. I think you've covered exactly how I often respond as well. And I think it is a tricky conversation and sort of both wonderful that the public in general is thinking about the nature of scientific studies and paying close attention to these numbers, but also, and so I tend to start with sort of acknowledging how thoughtfully somebody is considering their own health and safety and what's best for them. But exactly as you've said, that some amount of what these numbers look like depends on who happened to enroll in the study, who happened to get sick, who happened to get exposed during the period of the study. And so because these weren't used in the exact same study populations, we cannot compare them head to head. So those numbers don't mean that the mRNA vaccines are better or more effective than the J&J vaccine. What they both mean is that they were both significantly better than not getting vaccinated by all measures that matter, by preventing illness at all, by preventing serious illness, and preventing hospitalization and death. So if anyone on this call has a better way of sort of explaining that to folks to understand that, that the numbers don't reflect a true comparison between the vaccines. But what we do have is really, really rigorous scientific evidence that they all work very, very well. And that all of the science behind the studies themselves about how we understand how the vaccines work, how we've seen other vaccines work, what we know about the disease, all of that also leaves us thinking that these vaccines are near equivalent probably in all measures, and that they may have slight benefits over the other. The major difference is getting one shot versus two. So the only time I think people are right when they say I'd rather get one shot compared to two, then that's one of those ways in which Johnson & Johnson really does have the advantage. But I think the most important thing is that the best way to protect yourself is get vaccinated as soon as possible. The earlier you got the vaccine, the longer you have protection from it. So as soon as people are eligible, we want them getting vaccinated. And so that's the other reason we don't want people trying to worry too much about, one number versus the other, is that the benefit of getting anything right away far outweighs any true difference, if it turned out to be there, between getting a slightly less effective vaccine now versus later. So sooner is the most important criterion.
And I will say just one thing to the person who raised the question. One of the things I've been sort of fascinated by is I anticipated a lot more hesitancy with folks wanting J&J, and we're not finding that at the clinics. And as a matter of fact, I think the point Dr. Redmond raised is there are a lot of folks who'd rather have one shot than two. And so there's been a higher level of interest in it than I anticipated.
Mm-hmm.
Why doesn't Santa Clara County use VTA to get a larger population in the community who are unable to travel to these sites? So we are using VTA. VTA is offering free rides to anybody who can. All they have to do is show that their appointment, either with a piece of paper or a the electronic notice that they have an appointment, and they can ride VTA for free. And I appreciate the question, because what you're reminding me is that we've got to do more communication around that, because it's actually pretty critical. The other thing is that we've been working really hard to get all the VTA drivers vaccinated. And what that has meant is that we have more and more people who are available to ride those buses. Oh, I apologize. I moved away from my mic and I'm speaking more softly than I normally do. So VTA is allowing for free rides, and you can see that there's some information in the chat for you to be able to share again with your communities. This is a great thing to be able to link out to. And then I'm going to ask the staff if you can put the Facebook address in here too, so folks can sign up directly to the Facebook page. And so now the other two questions we have look like they're community outreach questions. So if there are any other questions about the vaccine, let's get to those before we lose Dr. Redman or Dr. Smith.
May I respond to one I saw flow by in the chat, and I'm not sure I addressed it well earlier. Somebody asked, how do the new variants of COVID that we're seeing respond to the vaccine, or how well do the vaccines work to protect against these? And again, I think the most important thing is we are seeing, when they're studied head to head, because a number of these vaccines have been studied in populations experiencing the variants, that they still work very, very well. So not only do we think that there is still a very good match between the protection you get from getting any one of these three vaccines and even these new slightly more contagious or potentially more deadly variants that have been circulating. So not only do we think these vaccines protect very well against the new variants, but even if they didn't, you would still be much better protected, and the community would be much better protected getting a partially active vaccine than not getting vaccinated and waiting until there's a targeted one. So that's for a couple of reasons. One is that even partial immunity can make the difference between somebody being critically ill and mildly ill, or very contagious versus slightly contagious. But also, the less transmission there is in general in a community, the less opportunity for the virus to evolve and cause new variants that could cause new harms. So once again, even though the rise of these new variants locally is pretty scary and raises an even more extreme risk for our unvaccinated populations, and so all the more reason to continue wearing masks and practicing distancing and following the other recommendations. Still, the single most important intervention to protect against these new variants is getting vaccinated as soon as someone's eligible.
Dr. Redman, could you just touch on the importance of testing if you haven't been vaccinated, and do people need to get tested if they have been vaccinated?
Absolutely. So certainly the need for unvaccinated folks remains the same, if not in the last week or so, even more concerning or more important, just because, again, that beautiful decline in cases we've been seeing for several weeks now really has not only leveled off, but started to creep back up. And the last two times we saw it creep back up at this rate, it shot up pretty rapidly. We're still optimistic, or at least I am still optimistic, that because we have done a good job of vaccinating as quickly as we can with the supply we have, that this won't look anywhere near as deadly or severe as the winter surge. But we certainly are at an inflection point right now. And so it's a really, really important time for folks to continue to practice as much distancing, masking, and avoiding interpersonal contact where it's safe for them to do so, as it has been in the past. And a big piece of that is continuing to get tested. So if you're in a population who's really at any risk at all because you leave your home to work, or care for people who leave their home, or interact with family members who do, then we both recommend the routine testing that we always have in the same frequency that we have previously, as well as testing right away if you develop any symptoms. For people who've been vaccinated, again, this is another tricky one. In general, we still recommend that people get tested on a regular basis, even if they've been vaccinated, if they're in one of those high-risk professions where you have to work outside the home and are recommended to get regular testing. There are some circumstances where we've said you can get tested a little bit less frequently if you're vaccinated. And that's because every day as we see more and more safety data about the vaccines and more reassuring data about the longevity of the protection against serious illness, we're also getting more and more information that not only do these vaccines keep you from getting very sick, but they make you less likely to get even an asymptomatic infection and less likely to spread an infection if you get one. So it's not just protection against serious illness. There probably is a good amount of protection against illness at all and being contagious, but it's not perfect. And that's why people who are vaccinated, if you're out there in the world, we still recommend some regularity of testing. And absolutely, if you get symptoms, get tested right away, for vaccinated and for unvaccinated as well. And all of the same locations in the county that have been offering very easy access to testing for months now continue to be available to you. And still going to sccfreetest.org, we can get you access to a COVID test very quickly.
That's great. Thank you. And I think that my team put in the chat a number of data points and information and ways to share and get information. And I'm going to thank you. I want to say a really very sincere thank you to both doctors, and really helpful in getting all this information out. And so, yeah, so, and the testing sites are still there. So what we'll do now is we're going to go to Jack, and I think Jack and our team are going to explain how you can get this information out. And let's do a virtual round of applause for Drs. Smith and Rudman. We really appreciate you. And I think, Jack, am I turning this over to you now?
Yes, Alex and I will now present about the outreach tools that the CAP team has for all of you.
And you have a couple questions in the chat about how can I position myself as a community resource, and the other from another listener is, do we have posters in other languages? Which we do. I'm not sure about Aramaic, but we'll look at that. All right, Jack and Alex, thank you.
You all see this?
Yes.
Oh, great. Okay. Full screen now. Great. Thank you, Supervisor. So hi, everyone. My name is Alex Lynn, and I'm part of the CAP team in Supervisor Chavez's office. My colleague Jack McGovern and I will give a presentation on COVID-19 communications. I will begin with top-line messaging, vaccines, sccfreevax.org, testing, sccfreetest.org, and county resources. And then Jack will go over the weekly outreach toolkit and social media. So the community is experiencing information overload, including, unfortunately, a lot of misinformation. And all of this is resulting in pandemic fatigue. To combat this, we're providing top-line messages of the week for you to emphasize in your information dissemination and outreach. Oftentimes, these messages will be the same from week to week, but they do change based on what is happening in the community with vaccine administration, case rates, and other factors. Of course, our top-line messages right now are: get vaccinated by going to sccfreevax.org. Get tested by going to your healthcare provider or going to sccfreetest.org. And reduce your risk by masking up, staying more than 6 feet apart, and staying home when you can. The infographic on the left is one of many available on the County of Santa Clara Public Health Department social media, as well as the CAP social media accounts, which Jack will go over and which we've shared the links to in the chat. As you heard today from Dr. Smith and Rudman, there's a lot of information to disseminate related to vaccines, but here are our top messages: that it is safe, that I and we will get the shot when it is our time, and that we should not drop our guard. The top questions in the community right now, understandably, are whose turn is it now, and when is it my turn? All members in phase 1A and phase 1B, people with qualifying high-risk conditions, and county residents age 50 and older are now eligible and may receive vaccinations through the county, regardless of their healthcare provider or insurance. The county health system and several other health systems have implemented a no wrong door system, as Dr. Smith mentioned earlier, where we're providing vaccines to all who are eligible regardless of insurance. For up-to-date information on the vaccines or to schedule a vaccine appointment, please refer people to sccfreevax.org or to 211. I know you've heard sccfreevax.org and sccfreetest.org many times during today's training, and I assure you that is intentional on our part. As a reminder, vaccine availability and eligibility are changing rapidly. The county updates sccfreevax.org regularly as new information becomes available. The counties launched the data dashboard with info on vaccine administration to county residents, including the total number of residents vaccinated to date. You can view the information by age group, gender, race and ethnicity, date, or overall. So if I may show you the freetest.org website. Actually, being flexible. So Dr. Smith already showed you the websites earlier today. So let's skip right past those. And actually, now we go back to Jack, who will be discussing the weekly outreach toolkit and social media.
Perfect. Thank you, Alex. If we could go to the next slide. Perfect. Hi, everyone. My name is Jack McGovern. I am one of the CAP team members. I'll be walking us through the county support resources during the pandemic, the outreach toolkit, and the community ambassador program social media. So first, we'll go over the county support resources, which we'll ask you to share with your friends and neighbors. On this slide, you'll see a full list of websites, phone numbers, and emails available to support county residents. So when you go spreading information to your community through the ambassadors program, you'll be able to share with them these resources regarding COVID-19 information, including sccfreetest.org, sccfreevax.org, resources for workers and businesses. For many of our ambassadors, this section is key. I think we all know, at least one business owner who is really struggling during this pandemic and the shutdowns and quarantine. So please send them these numbers, websites. Support services, including our COVID-19 support team and Second Harvest Food Bank. The COVID-19 support team helps those who need help isolating or quarantining with a positive case by providing housing, transportation, meals, and more. So we'll be sure to send all this information, this presentation to you, so you have the information readily available when you share it on your Facebook, when you email it out to your friends and neighbors, in case they ask for specifics or they need help in one or more of these areas. So next slide, please. Now we'll go over the outreach toolkit. The outreach toolkit is a weekly newsletter sent out to each of our ambassadors. It's been prepared by the County Emergency Operations Center and contains multiple posts regarding the top line messages of the week. After this call, you'll be sent a link to sign up for the toolkit. So please sign up. If you do not receive the toolkit next week, please make sure to check your spam folder and email us at sccap@bos.sccgov.org. So if we could put the toolkit on the screen, please. Just give it a minute here.
Sorry, Jack, let me grab it.
That's okay. And again, the SCC CAP email, we'll send that out in our follow-up email as well, so you don't have to write that down. Perfect. So if we could scroll through here, just give you a sense of sort of what the outreach toolkit looks like. So again, this is sent out every week. There are multiple templates of social media posts for you to share. So in different languages as well. So you can save the image, copy the post, put it on your Instagram, on your Twitter, on your Facebook. We have it in English, Vietnamese, Tagalog. We have videos from YouTube. Again, this is all information prepared by the Emergency Operations Center, so it's very up to date. We have top-line messaging for Easter this weekend, for Cesar Chavez Day. So lots of different information for you to share. And then if you access the toolkit in your web browser, which you can do by clicking the View This Email in your browser at the top of the email, you can view past issues of the toolkit as well. So there's templates from previous weeks, there's information for previous weeks as well. So there's a whole wealth of information that you can pass along to your friends and neighbors. So we want to keep the messaging simple, to the point, and as we have done so throughout this training, repeat them as many times as possible. It really helps augment societal behavior. So feel free to ask us any questions about the toolkit after this presentation. We'd be happy to answer it. And then finally, we'll go over the CAP social media pages. So if we can go to the next slide, please. So the Santa Clara County Community Ambassadors Program, Facebook, Twitter, Instagram, and YouTube are all live. Please, after this, go like and follow us on all the platforms to stay updated on all things CAP and for easy reposting of information to your personal social media accounts. So I'll go through now the sites to make you familiar with them. Here we have our Facebook page. On this page, you'll find lots of posts from the Outreach Toolkit, updates on upcoming trainings that you can share with your friends, where you can RSVP. We'll have videos from different sources. So please like and follow us and share any of our posts, and you can brag a bit to your friends and family that you're an official CAP ambassador. So if we can go to the Twitter page next, please. Here we have the CAP Twitter page. You'll find updates from the CAP team, County Public Health Department, California State Public Health Department, and other pertinent information related to COVID-19. So again, this is a great resource for you to share things. We update this constantly. If you can go to the CAP Instagram page, similar to our Twitter page, we'll post from the County Outreach Toolkit and other updates related to the county. We have lots of fun resources here for you to share. We'll do polls on our Instagram story every so often too, so you can participate in that too. So especially if you have younger people that want to get involved, this is a great resource for them, because I know a lot of young people use Instagram as well. So feel free to send them this. We'd be happy to have them. So finally, we'll go to the Ambassador YouTube channel. This is where you'll find recordings of past trainings. So we've done basic trainings in Spanish, in Vietnamese. We've done supplemental trainings on behavioral health resources. So you can find all that information here, rewatch trainings, get familiar, send them to your friends and peers. There's lots of good resources there for you to share as well. So once again, all of these links will be sent to you via email after this training, so you don't have to worry about it. We'll make it as easy for you to sign up as possible. So with that, I'll pass it back to Supervisor Chavez to close this out, and we'd be happy to answer any questions you have.
Thank you so much. And I'll just see, are there any questions? We'll look at and check on the Aramaic posters. I don't know the answer to that. And I think the most important thing in terms of positioning yourself is just letting people know you've had this training and you're happy to answer questions for them, or share our Facebook with them. And that way you can connect them directly to us. And if you have questions or any concerns, you can feel free to reach out to our office as a resource. Especially sometimes there are things that are a little tricky that we're all trying to figure out together. And there may be things that aren't working, and your alertness will help us solve problems that are in the process. So are there any questions? If folks have any, they can raise their hand or put them in the chat. And as I'm looking, I don't see any. You all feel well prepared and able to go out and get information out to the community? I'm going to take that as a big yes. Jack just put his information in the chat, so feel free to reach out to Jack directly if you have any questions. I appreciate seeing so many of you who've been to a million of these trainings. I'm so grateful to you, because I find every time I hear these, I learn something new. So I really appreciate that. Well, listen, thank you very much, all of you. I want to thank our staff, Jack and Alex, Kathy and Victor. Give them a virtual round of applause. I don't think we've given any of them a Saturday off in a long, long time. So I appreciate them. I really appreciate the work that they're doing. And I want to just say, and thanks, David. I want to say to all of you, thank you for choosing to be leaders in our community and serving others. I appreciate each and every one of you. These are challenging times. And to see so many leaders who've stood up during our toughest times here as a community is just heartwarming to me. And I know to many others that make this, it's part of what makes this place such a great place to work. And on the whether or not we can get some VTA posters, we will work on that. That's a great idea. All right, all, be well, have a safe rest of your day, and be safe over the weekend. Celebrate, but from far apart, wearing your masks, and be safe and be well. Thanks all. I appreciate all of you joining us. Bye-bye.